Aprovecho para decir que el comité científico de este congreso se siente muy satisfecho de que el doctor Grimaldos haya aceptado presentar sus resultados por primera vez en este congreso, y estamos hablando de los primeros resultados conocidos sobre iridoplastia láser para el cambio de color de ojos. El doctor Pedro Grimaldos es doctor en Medicina y Cirugía, especialista en oftalmología, Fellow del Dohan Eye Institute en Los Ángeles, Fellow del Bascom Palmer Eye Institute en Florida. Sus experimentos en humanos destacan entre los más impactantes y polémicos de toda la investigación clínica, bajo mi punto de vista, en lo que llevamos de siglo XXI, y en este momento el doctor Grimaldos es el único oftalmólogo del mundo que se atreve a cambiar el color de los ojos con láser. Nos presenta la comunicación Láser NewEyes para el cambio de color de ojos, 2 años de experiencia. Doctor Grimaldos, muchas gracias y escuchamos todos muy atentamente.
Ladies and gentlemen, it's for me a great honor being invited to this prestigious conference. My name is Pedro Grimaldos, Director of EYECOS Clinic and original inventor of NewEyes Laser to change the color of the eyes. Then I will present my results after more than 2 years of experience. In 1999, we invent the Prelaser technique to correct presbyopia with a Cymer laser, and already in 2009 we started testing to change the color of the eyes. In 2012, we started clinical trials with NewEyes Laser. You can see the poster for the Congress of 2005 on phacoemulsification. Vision collects more than 90% of the information that we need, but each value is bigger as a means of communication and seduction, as well as the transmission of energy and emotions. The eye color depends on the pigment. There are 2 types, melanin and lipochrome. Dark melanin is named as eumelanin, and the yellowish as pheomelanin. Otherwise, the distribution of the pigment is determined genetically by multiple genes responsible of different colors. We can meet with infinity types of colors. Brown is the most abundant, with almost 98% of the people. By contrast, blue eyes are a minority, with less than the 2. Inside the anomalies, the most frequent is the heterochromia. The aniridia is the absence of iris, and albinism the complete lack of pigment, with serious functional and anatomical problems. Here you can see very famous people who suffer from congenital or acquired heterochromia. Note that more than one would like to solve the problem with of course, safe and effective technique. But is it really possible to change the eye color? My dear colleagues, my answer is yes. Interest dates back to very old, as we see in this Egyptian statue where we appreciate eyes carved in ebony and white quartz to enhance its brightness and color. Today, eye color can be modified by computer programs as Photoshop, mental suggestion, or contact lenses. We can also do it permanently with intraocular lenses or even laser techniques. I'm going to introduce our solution, the NewEyes Laser. It all began with the discovery of colors in the interior of brown eyes, and I have to tell you that exist in 100% of the people. As we can see in these incredible pictures, children with Waardenburg Syndrome and very pigmented skin and hair can show extreme bright blue eyes. This is a genetic disease, of course, but we can also find this incredible color in any healthy people. The inventive process begins with the discovery, continued with the invention of a laser technique, and led us to the third step, technological development. Then we went to a German specialized center who was in charge of designing and manufacturing as well as trials in animals. EYECOS Clinic has made innovation and carry out the clinical trials in humans. But before continuing, I have to stress the extreme difficulty of the project. If we compare three ocular tissues where we use laser, the cornea, the lens, and the iris, we will see that the iris is by far more complex because its surface is irregular and mobile, and inside we have abundant innervation, vascularity, muscle fibers, and a high degree of pigmentation. This complexity makes us very difficult the action of the laser inside without damaging their noble structures. For many reasons, more reminds us of the iris to the retina by her organization in layers, nervous plexus, blood vessels mesh, and a pigmented epithelium, where different lasers are used. We go to the clinical trial. Connection to the admission criteria, they have been very stiff, not accepting minors, general or eye pathologies, and family disease. Only patients with low refraction errors, normal pressures, and degrees of pigmentation 1, 2, and 3 have been admitted. The grade 1 shows low levels of melanin, grade 2 a little more dense, grade 3 have medium presence of melanin, and grade 4 has not admitted in the study the maximum concentration of pigment. Pre-laser and follow-up clinical protocols of functional and morphometric tests are available on the website eyecos.eu. Informed consent and laser treatment protocols are also available on this website. Here we can see the NewEyes Laser, and in this picture we see the OCT instrument. This is the first time globally that I present my clinical trials. Outcomes going to expose in a visual way. First of all, we see a case of a congenital heterochromia. And on this picture, left eye already veiled, which has gone from brown to blue as the right. Now in more detail, we can see the clear difference of color before and after the treatment with the NewEyes laser. But we have also treated partial heterochromies, macular and acquired, secondary to treatments with anti-glaucoma prostaglandinics drops. You can see here a series of macular heterochromy, in the center with disappearance of the nevus, and right with an obvious change of color after 2 months follow-up. I show you binocular results of patients with originally brown eyes looks and which changed to green and blue. Now we'll teach a series of examples of eyes grade 2 and 3 and their final results. First of all, a blue tone. In this other case, to a greenish color. Again, a blue case. Blue eye with irregular surface, green otherwise. and one example of a greenish final iris presenting nevus previously. In this amplified eye is clearly seen color change from initial brown to the final outcome that was green. But I have to admit that our colors are very special and original, so much that we are often not according to patients to classify them. Many patients said me, "Yes, doctor, I am very happy, but which color I have finally? Because it seems green or blue? What do you think about, doctor?" Therefore, in order to solve this problem, I took the decision to use a method of objective and automatic analysis, the spectrocolorimeter. In this way, we easily can obtain an exact Pantone number previously the laser application and on each subsequent control. Very nice pictures, don't you think? But we absolutely have to analyze at this point the level of quality of the NewEyes laser technique. And for this goal, we have studied its safety, efficiency, and predictability. Regarding the security, we must say that vision acuity and eye pressure will alter temporarily after each laser NewEyes session, returning to normality a few hours later and recovering their initial levels once finished laser applications. Usually patients don't have pain and can go back to home by self, walking alone without care. Fortunately, and as we planned, treated patients do not complain of discomfort such as blurred vision, pain, redness or irritation, dryness or itching. Now we have collected complaints from photophobia or night glare. Through test of deslumbrometry, it can be shown that there are no differences in recovery of visual acuity between before and after the treatment. But why not photophobia appears is because NewEyes laser does not harm at all the posterior epithelium layer, so densely pigmented, forming a true light-proof barrier. This picture shows us big vascularity, muscle fibers in the posterior side, and a high pigmented epithelium layer. This last barrier protects the eye, similarly a phosphorid curtain. The integrity of the posterior epithelium ensures a total care to UV rays. Here you see OCT images of the highly refractive posterior epithelium before the laser treatment, and after the treatment you can check the integrity of the same. In connection to the corneal endothelium, we have found the same before and after the laser sessions, and there are no statistically differences in the population of endothelial cells. The gonioscopies show normal or minimally pigmented angles with regular profiles of the iris in OCT and no signs of atrophy to the backlight. Completely the contrary of what we find in pigmentary glaucoma syndromes, in which the angles are very pigmented, the profile of the iris is typically concave, and discover the iris atrophy. Following our protocols, we try every day, but Schlemm Channel, measuring about 200 microns, is hardly located always, because the resolution of the OCT devices is right now still limited. Efficiency is close to total for 1, 2, and 3 degrees, demonstrated using spectrocolorimetry. However, the predictability is something less than 80%. The formula is based on 3 main factors: the degree of initial pigment, skin and hair pigmentation, and family history. We can also have comparative photographs of patients already treated, and we have also commissioned the development of a genetic analysis kit of polymorphic genes of the eye color, but is not available yet. Histological bases that determine the internal color of the iris are 3. The density of the vascular mesh determines the blue color. The density of collagen fibers modifies its bright and luminosity, and melanin density marks the final mixture. Once are mixed these 3 pigments, we get the finished color, always different for each patient. These are the golden rules, which can guide us on a practical level. As darker brown, more likely to get green. As clearer is the brown, more likely go to the blue. Tones will be similar than originals, but family history breaks these general rules. If blue eyes family will get blue eyes, if green eye family will get green eyes. Now go to the chapter of complications. The most common are mild, transient, and self-limited. They are the eye pressure raises, microhemorrhages, asymptomatic iritis, and minimal pigment deposits. In this study, we found 2 serious complications only, but fortunately without involvement of the visual acuity. On the left, you can see an Uret-Savalia syndrome, and on the right, a corneal edema, but solved at all within only a week. At this point, I have to confess you that after 25 years of experience as an eye surgeon, my early days with NewEyes Laser have been by far much less traumatic than when I started in '96 with LASIK procedures, in which I imagine as a warrior ninja slicing the cornea from end to end with a katana. However, LASIK is now a major procedure. And what about when I began phacoemulsification surgeries in the year '94, in which I saw as a bullfighter nailing the sharp rapier in the interior of the eye in the direction of the central retina. Phacoemulsification is also now a major procedure. But I must warn that there are international studies that relate high degrees of ocular pigmentation with glaucoma and the lack of pigment with choroid melanomas and age-related macular degeneration. I'm convinced that patients treated with NewEyes Laser will not be affected of these complications in the long run, for the reasons that I have stated before. Finally, we arrive at the conclusions. I have to say that NewEyes Laser is a safe, effective and predictable method to change the color of the eyes. It presents very few serious complications, and the chief aesthetic effect is always natural and discreet. Certainly there's lack long-term studies that confirm our conclusions after 2 years. I have to say also, my dear colleagues, welcome to the future, because NewEyes Laser has opened the main door of a new eye specialty named intraocular aesthetics. Absolutely, I'm sure that NewEyes Laser is added to refractive surgery and eyelid surgery as a new area of the cosmetic eye surgery. My friends, welcome to a future of innovation, but responsible, where the research and development give us a number of safe, effective and predictable eye techniques. Finally, I can announce the imminent arrival of the second generation of NewEyes Laser, the new one-day technique, innovative diagnostic tools and 3 new lines of research. The presentation of the third generation NewEyes Laser, named the Intratom, is planned in the not too distant future. Has been a real pleasure to present to you as first time around the world our excellent NewEyes results. Thank you very much.